Again, I want to thank everyone for coming out tonight. We know it takes a lot of time and effort to come out to a seminar like this and to give up a few hours of your life to learn about this stuff. We do hope you learn quite a bit. I'm Dr. Melrose. I've been a part of the surgical refraction team since we started doing this 11 plus years ago, something like that. Along the way with our laser surgeries and the patients that we've helped, we've met a lot of neat people. And some of the neat people that we've met along the way are very recognizable in the community. And we have a couple of those very nice people with us here tonight. If you live in this area, you know Joe and Jack from their radio show and from TV and stage and screen, I hope someday. But we did surgery on them several years ago, 5-6 years ago, and they're going to come out tonight to talk to you a little bit about what they're experiencing.
We're going to show you a video about the way the digestive system works. It's not going to be easy to watch. So. I really did enjoy Dr. Reed's story about the woman that couldn't tell her dog from her kid without her glasses. Sending the dog off to school, walking the kid on a leash, that sort of thing. And that's what can be helped by coming here.
A couple of things, if I may point out the obvious, that's what I do for a living. A couple of things I noticed in listening to Dr. Reed was, number one, the joke he made about if he comes back and he can't see, he ought to run out of here. I think that says something about his confidence and the fact that he's had the surgery himself. I mean, there is virtually nobody within 200 miles of here who knows more about the human eye than Dr. Reed. And you know, I'm about to tell you that I'm a really skeptical guy about virtually everything. And I was extremely skeptical about this idea. And the more I learned, the more I read, the more I researched, the better idea I thought it was. But what I knew, what I learned, obviously pales in comparison to these guys here. And I think that, you know, that's pretty significant. And so, like I said, I did a tremendous amount of research about LASIK surgery and came armed with some pretty good stack of facts when we met with Dr. Reed for the first time. He started talking and I said, what I want to know is, are you using this kind of gear? And he said, yeah, we are. I said, are you using this sort of microkeratome? And he said, of course we are. Yeah, and I just went right down the list, and it was all everything that I was supposed to be hearing. And so by the time it was time for the procedure, like our buddy here, and it wasn't just the Ativan, I was completely relaxed about the idea and confident and really excited about it because I could not see a bit. I mean, I wasn't legally blind or anything, but I couldn't read my alarm clock in the morning from 2.5, 3 feet away. You know, do as Dr. Reed said at the beginning, do as much research as you want. Be as skeptical as you want. They're your eyes. You ought to be. I'd encourage that.
I, on the other hand, did no research. I'm very busy. There's a lot of good stuff on TV, and I didn't feel that I had the time to look into that because I don't know. I just took his word for it. But I do have a problem with medical procedures. I don't like to get anything done. I am what they call in medical terms a wuss, or if you prefer the Latin pansy. And I don't like to get my teeth cleaned or anything like that. I mean, I've never had a cavity, so I've never had anything done. I mean, I've got a huge fear of doctors, and this, by the time I found out what it was all about, I wasn't worried about it at all. I really wasn't, and it wasn't a big deal. And if you are still worried about it, that Ativan would relax you if you're in Fallujah, so it'd be fun. I mean, that stuff's pretty good.
And people who know me, particularly my parents, can tell you I've made some questionable decisions in my life. I've got, quite a number of scars on my head from getting it split open. I'm kind of that sort of guy. On the other hand, I absolutely adore my wife. I mean, I just cherish her. And based on my experience and everything I read and everything I did, I was excited about her coming to Griffin Reed Eye Care and getting LASIK surgery too. And both our wives have had it, and both of them see great. And so it's just been a tremendous experience.
We've both had it done. Both of our wives have had it done. Does anybody have any questions they'd like to ask us? That's probably the best way to get any information out of, you heard the doctor talk, now you can talk to some people who just were plain patients.
How recently?
Recently. We were just talking about that, I think, about 6 years ago or so, 6.5 years ago.
Really?
And our wives were a year and a half, 2 years? Something like that. But yeah, we're well down the road. Everything's great. In fact, I just had an eye exam a couple of weeks ago, I guess, and Dr. Reed said if he hadn't done my LASIK surgery, you wouldn't know that it had been done. The healing is that complete and that good. So.
And it works for a variety of situations because Joe's eyesight was really bad, and mine was, I don't know if there's people here that are like the way my eyes were, but I barely needed to wear glasses. I wore them at night when I drove. If I went to the movies, other than that, I did never wear my glasses, and it was fantastic for me. It's been so long now that I don't even really remember what it's like to not be able to see perfectly.
Yes.
If you were really bad on your sight, do you need glasses at all now?
No.
None.
Sunglasses if you want to look cool.
Okay.
And that's one of the greatest advantages, honestly, because if you've been wearing glasses your whole life, you miss out on the whole looking cool sunglasses thing.
Yeah.
And it's shallow. It's shallow.
But it's true.
Yeah, let's face it.
And then also, how long did it take you to heal and be from your surgery to being where you could do anything? How long does that take?
I know for me, I got it done here in the evening, and I had to leave town the next day for to fly back to the Midwest for my grandmother's funeral. That's why I remember it, because it was looking out the window of the plane the next day at like noon. My eyesight was perfect, no problem. I took my eye drops with me, but that's all it was for me.
I guess I have
Yes, sir.
a two-part question. One is, have either one of you had like deterioration since you had the surgery? And also, like, I've talked to people who've had like a halo effect when they're driving.
I had a little of that afterward at night, and if my eyes are particularly tired, I'll get that. But I think if anybody has particularly tired eyes, that happens a little bit. But it's not been a
To
problem.
me, the best testimonials are, first of all, several of the major sports stars that have had it done. That they've got, like Tiger Woods or whoever, they've got too much money on the line to do it if it wasn't absolutely a good idea. And the fact that the military now allows people to get it done so they can become fighter pilots, because you used to have to be born with 20/20, and then for a long time they didn't accept any sort of eye surgery. But then they decided that okay, it's been around long enough, we've had enough thorough tests and long enough to track it.
Yes.
I just want to say I love your show.
Oh, thank you. Thanks. That's very sweet. Is that it then? Oh,
I had one. Have many of your coworkers at the station had this done since?
We work with a half dozen people at least that have had it done here.
yeah.
And they're all pleased with it. I take it.
Everybody's great. Everybody's great. And it's funny how everybody just grills us
Yeah.
before they come over. But that's okay. Good for them.
Yeah, it's getting to be common enough now, I think, that everybody knows somebody that's had it done. But when we got it done, it was still new enough. Boy, people were asking us questions all the time.
Is that it? Well, thanks everybody. Appreciate it. And good luck and do your research, and you're in wonderful hands.
Thank you.
Thanks for coming.